Now, for more insight into the rising costs of drugs in the U.S., I'm joined by Wendell Potter. He's a former health insurance industry executive and author of Obamacare, What's in It for Me? Welcome to the show.
Thank you, Rachelle.
So if you're someone suffering from these diseases and you hear some of these price tags for a cure, which is completely out of reach for the average person, how do we justify these prices like the $475,000 for the cancer treatment Kymriah?
Well, there is no way to justify them. They're just completely unreasonable. They're unreasonable, they're unconscionable, and they're not sustainable. Drug companies, particularly in the U.S., are just able to price drugs based on what they think the market will pay. And the consequence is that a lot of people, particularly those who don't have insurance, and in the United States, there's still 30 million Americans who are uninsured. And even those who have coverage often have coverage that requires them to pay a lot of money out of their pockets for certain prescription drugs. So it is just simply not something that is fair or could be or can be sustainable.
Now, some of the drug companies do argue that they're putting a lot of money into the research and development, and there have been other headline stories of drug prices, most recently the jump in the price of EpiPen. So how can fair market value of a drug or treatment be assessed?
Well, we can't because there is so little transparency. But one thing that is not necessarily true that the drug makers want us to believe, they don't necessarily pay so much or invest so much in research. Much of the research is done at taxpayer expense by federal institutions or universities that have grants from the federal government. So much of it is paid for by consumers, by taxpayers. They do spend money, drug companies, to develop drugs, but much of the research is done by taxpayers.
Now, let's also look at outcomes. We know that Novartis says that if a patient fails to respond in the first month, there'll be no charge. But then that raises questions about how that should be judged and what happens to if the patient deteriorates after that time. How much should outcomes affect the price?
Well, I don't think that kind of scheme would work at all. I mean, you're exactly right. How can there be any kind of reliable data? Who do we trust to make sure that it would be done appropriately? I just don't think that is absolutely anything at all that would work. We do need to have some evidence about outcomes, and I think that what is needed, particularly in the United States, is some kind of means of determining what is a fair price for a medication. We just simply have nothing of the sort in the United States in particular.
So as we look at some of the prices of this medication, how do drug costs and funding for research and development in the U.S. compare to other countries?
Well, most other countries have some means of managing prescription drug prices. The United States does not. It is just simply, in the United States, much more of a free market affair. Yes, the Federal Drug Administration does regulate the industry, but there is no mechanism in the United States that is really effective in controlling cost. We have a multi-payer system in the United States in which most people have their coverage through private insurance companies if they have coverage at all. And the fact is that most private insurance companies have no ability in any real sense of controlling healthcare costs. So what we have increasingly in the United States, and also abroad, but certainly in the United States, is rationing based on ability to pay.
Now, after the backlash that we saw from things like the EpiPen price hike, we did see some smaller companies and startups trying to get some cheaper alternatives on the market. But how difficult is it for smaller, unknown companies to get their products to market?
It's very, very difficult because what we have seen over years is the incumbent, the large companies, are able to kind of rig the system and thwart competition. So the barriers to entry are very, very high in the pharmaceutical industry, just as they are in many, but certainly so in the pharmaceutical industry.
Now, being that a lot of companies at the end of the day are looking at the bottom line, what are some ways to really motivate companies to keep innovating while still asking them to keep the prices low for end users?
Well, keep in mind that drug makers have some of the biggest profit margins in any industry. So they're making a lot of money as it is, and they certainly could market or price their products at a price level that would still assure them and their shareholders of a reasonable profit. while making their medications more available to more people. But it's a very, very profitable industry already, and increasingly so. Yes, sometimes they have medications that are in the pipeline or in development that don't turn out as they hope they will, as Novartis is experiencing. But on the other hand, excuse me, Eli Lilly. But you're seeing that by and large they make a lot of money. More so than almost any other industry. When you look at the profit margins for pharmaceutical companies, for example, compared to insurance companies, for-profit insurance companies, there's no comparison.
All right, well, thank you so much for your insights. Wendell Potter,